Hi guys, my name is Modinat and I'm a pelvic health physiotherapist at Sunny Physio and Wellness in Little Island. I want to start by asking you a simple question. Have you ever been told that bladder leakage, pelvic pain or discomfort with intimacy is just part of getting older? Or something you have to accept after childbirth or surgery? If so, you are not alone. In this video, I'm going to explain what the pelvic floor really is, what pelvic floor dysfunction means, why it happens, and most importantly, how pelvic physiotherapy can actually help. Let's start with the basics. The pelvic floor is often misunderstood. It's not a single muscle. It's actually a group of muscles that sit at the base of your pelvis. These muscles support your bladder, bowel, and in women the uterus. But the role goes far beyond support. The pelvic floor works together with your breathing, your core, and your posture. It plays an important role in bladder and bowel control, spinal stability, movement, and sexual function. So when these muscles aren't working as they should, the effects are often felt in more than one area of the body. Pelvic floor dysfunction is a term we use when the pelvic floor muscles aren't functioning properly. A common misconception is that pelvic floor problems only mean weakness, but that's not always the case. The pelvic floor can be too weak, too tight, or not coordinating properly with the rest of the body. And because of that, people can experience very different symptoms, even though the underlying issue is coming from the same muscle group. One of the most common things I see in clinic is people who have been living with symptoms for years before seeking help. Pelvic floor dysfunction can show up as bladder leakage, difficulty emptying, pelvic pain, pain with intimacy, lower back or hip pain, or feeling of heaviness or pressure in the pelvis. Many people assume these symptoms are normal after childbirth, surgery, or with age, but they are not. They are common, yes, but they are not something you have to live with. Pelvic floor dysfunction rarely has one single cause. It often develops over time and can be influenced by things like pregnancy and childbirth, pelvic or abdominal surgery, chronic stress, heavy lifting, poor breathing patterns, constipation, or long period of sitting. Sometimes the issue isn't about damage at all, it's about how the body has adapted to these stresses over time. Many people are told to just do Kegels when they have pelvic floor symptoms, but doing strengthening exercises without an assessment isn't always helpful, and in some cases, it can actually make symptoms worse. If the pelvic floor is already tight or overactive, adding more tension through squeezing can increase pain and dysfunction. The pelvic floor means balance. The pelvic floor needs balance, coordination, and proper breathing, not just strength. This is where pelvic physiotherapy comes in. Pelvic physiotherapy looks at the whole system, not just the pelvis in isolation. We assess breathing patterns, posture, core control, hip function, and how the nervous system interacts with the pelvic floor. Treatment is always individual. It's based on assessment, not assumptions. That's why one person may need relaxation strategies, another may need coordination work, and another may need gradual strengthening. The good news is that small daily habits can make a big difference to pelvic floor health. Learning how to breathe properly, manage pressure during movement, move efficiently, and allow the pelvic floor to relax when needed is just as important as strengthening it. Prevention isn't about quick fixes, it's about understanding your body and supporting it consistently over time. If you like to take next step, you can follow our YouTube channel where we share guided exercises for pelvic floors that are weak or overactive, along with more in-depth education on pelvic floor dysfunction. Make sure to subscribe and check the link in the description for additional resources. And if you think this video could help someone, feel free to share it. Thank you for watching.